Hey there, welcome to Just the News AM. I'm Carrie Sheffield, and our guest is joining us from California out there on the West Coast, Dr. J. Bhattacharya. Welcome, Dr. B.
Nice to be here.
So you just co-authored a great Barrington Declaration. Tell us about this.
Sure. I met with two top scientists, Dr. Martin Kulldorff, who's a professor of epidemiology, infectious disease at Harvard University, and Dr. Sunetra Gupta from Oxford University. The idea of the Great Barrington Declaration, Great Barrington is a town in Massachusetts, was to devise a new strategy for the COVID-19 epidemic. The current strategy has been utterly disastrous. This lockdown strategy has imposed costs and health costs on vulnerable people worldwide, to the extent where the non-COVID deaths are outstripping already, I think, the COVID-related deaths. We need a new strategy. And our strategy is one of focused protection. The idea is that you protect the vulnerable, people that are older, who we know that if they get infected have higher risk of death. But for everyone else, let them live their normal lives, reopen schools, resume arts, culture, and so on. The idea being that younger people, children, for instance, face much higher costs from the shutdown, costs in terms of their lives, costs in terms of actually health, than they do from COVID itself.
And you guys released this 3 days ago now at this point on October 4th. Today's October 7th. And you've gotten 3,500 doctors and healthcare professionals to sign on to this. What's been the reaction so far?
It's been overwhelming. So we have, as you mentioned, 3,500 doctors and medical professionals and epidemiologists who've signed on to this strategy, and over 50,000 now, I think, regular folk who just understand that the current policy can't go on. The idea of the focused protection plan that we're proposing is actually standard public health practice. Before the epidemic, countries around the world had this strategy, the one we're proposing, as the standard approach to an epidemic like this one. The lockdown itself that we have experienced is a panic move that happened in March that was not in the pandemic planning plan and is itself an aberration. It's not surprising that many medical professionals and epidemiologists have signed on to this plan. It's the standard, correct plan that we've had for years. The plan we have actually adopted is the aberration.
And when you say aberration, do you think that the shutdown was entirely unwarranted, or is there an argument to be made that we didn't know enough about the COVID-19 to know the extent to which the hospitals could be strained in overcapacity and not having the most severe patients being treated and maybe possibly turning people away?
Yeah, I mean, I think there was some strength to that argument. I mean, when there was a lot of uncertainty about hospital overcrowding, that made some sense. But we very quickly learned, in the United States anyways, that only very few places had any risk of hospital being overrun. The vast majority of the country, the hospitals were closed at great harm to health, with when they were facing absolutely no risk of being overrun whatsoever. And as a consequence, what we've had is people who have had heart attacks that didn't come in, that died at home, people with strokes who died at home, people who were so afraid of COVID that they skipped their chemotherapy. They were more afraid of cancer or COVID than cancer. They skipped their mammograms, they skipped their prostate cancer screening or colonoscopies. We're going to see a rise in cancer death as a result of the lockdowns. People also skipped immunizations for their children. The lockdown costs have been absolutely enormous and devastating for health.
And Trump himself getting COVID, a lot of his critics see this as evidence that he was cavalier, that he didn't take this disease serious enough, that he wasn't implementing mask regimens strongly enough. What's your take on him getting COVID? Do you think there's truth to that argument?
Well, obviously COVID is a serious disease, and he's 74. I think obvious that for him, he is in a high risk group. The aim of the focused protection plan is to protect people like him. Use all our resources, both testing and treatment resources, to reduce the probability that he gets COVID, and if he does get COVID, to treat him appropriately. I think that's the right thing to do. I think it is actually quite problematic to take a disease and then decide that we're going to blame the person who gets the disease. We did that with HIV, and it was an enormous mistake. It took a long time to destigmatize HIV, for instance, blaming someone who got it. Here we're doing the same thing with COVID. Someone gets a disease, a serious disease, and we decide that we're going to blame the person for not doing the things that they needed to do. It's their own fault. I think public health messaging should not blame people for getting a disease. It's also is another enormous mistake that we've made.
And in terms of Trump recovering, some folks on the other side have said, well, this actually makes the case that what he's saying about the fact that the fatalities percentage has been going down. We know more about the disease. We know how to better treat the disease. He could be case number one about the fact that very prominently had someone who got this and beat this disease. What's your take on that?
Yeah, I think we have learned a lot about how to treat the disease since March, and President Trump's illness illustrates that very well. I think. I mean, he received several treatments that were either not known about, or that we didn't know could be used to treat COVID in March. And it seems to me, looking out from the outside with no special information at this point, that he's done very well with it. I think he said something very important the other day, which is that we shouldn't live in fear of this disease. I'm paraphrasing, but that we shouldn't destroy our lives in order to avoid this disease. We face as humans hundreds of pathogens every day, and we take precautions sometimes to avoid them, appropriate ones. But we don't destroy our lives and live in fear of those pathogens. We continue to live our lives despite them. I think we have to have that same spirit with COVID, or else the harm that we're going to do to our children, and also to older people who face risk of the disease, is just too enormous. The right plan, the plan that we proposed in this great Barrington Declaration, is to protect the vulnerable with this focused protection, and let the rest of us live our lives.
And on this issue of COVID-associated versus COVID-caused death, to your point on this question of fear, do you think that the media is being responsible in how they report about deaths that are associated with someone who has COVID, but perhaps maybe one of the other variables was much more influential in the death? So talk a little bit about this difference between COVID-caused death versus COVID-influenced or COVID-associated death.
I mean, anytime somebody dies, obviously it's a tragic thing. We don't want, as a public health professional, my goal is to minimize the deaths. It's complicated, especially if you're older and vulnerable. You have comorbid conditions. So, like, just to take an example, if you have a heart attack, and you're actually, one of the consequences sometimes of heart attacks is your lungs filled up with fluid, and then bacteria could build up, and then you die of pneumonia. Okay, did you die of the heart attack? Did you die, or did you die of pneumonia? It's hard to tell, right? So I think that's the issue I think you're talking about is it COVID associated? COVID can cause exacerbations of pre-existing conditions that cause mortality. It's another reason why you need a way to protect people from COVID, like the focused protection plan. The real issue is not, and you asked about the media. I think the media has not covered, my apologies to you, it's not personal, but has not covered itself in glory in this. It stoked panic when, in fact, the good public health practice is to provide assurance and good, accurate information. So, for instance, this idea that, this fact that young people, children, have very low risk of mortality from COVID. 1,000-fold difference between between the most vulnerable and least vulnerable, the oldest population and the least. That's a fact that everyone should know. You don't need to fear for your children's lives with COVID. It does, because they're, thank God, relatively protected from it. That fact is not really well known, I don't think, in the population, in part because the media has done a very poor job in conveying this basic fact about the disease. On the basis of things like that, I think we have a lot of support for closing schools, which is unwarranted. We've harmed children because of that fact, and created panic that's led to very poor policy.
And in terms of the declaration, are you calling for governments to adopt it formally? And what have you heard? I know you've been in to speak with the president's team, Dr. Atlas, and others there. What's your read? Do you think in many respects they're already kind of following that here in the United States?
I mean, there are some places in the U.S. and in U.S. states around the states in the U.S. that have followed that. So I think Florida and South Dakota, for instance, in the United States are following something very close to what I would call a focused protection plan. Sweden very famously has followed it from the very beginning of the epidemic. Just to give a data point there, they have 1.8 million children under age 15 that have been in school all through the epidemic in Sweden with no deaths up through July. Right. So it's in the U.S. by contrast, we've had more flu deaths for children since the epidemic than COVID-19 deaths, and yet we kept kids out of school. The effects on poor children especially are going to be absolutely devastating going forward. Schools are places where kids get other things other than just education. They get a very large fraction of our population kids get much of their nutrition from schools. It's places where abuse is picked up. Psychologically, it's really important for children to socialize, and we've decided that we're going to ask children to bear the burden of disease control at enormous cost to them when they face so little risk from mortality from this disease. It's not.
In terms of the masks, there are lots of debates, lots of conversation about masks. You had one of the senators who was at this quote-unquote super spreader event, as the media has called it, the Amy Coney Barrett nomination. Senator Tom Tillis was wearing a mask at that event, and yet he was still diagnosed with COVID afterward. What's your read on masks? And do you think there should be a repeal on mandating masks, or should masks be mandated?
Masks should not be mandated. Masks have a use in certain settings where people use them properly. So, for instance, in hospital settings and places where you can't avoid being in very, very close contact with people that are vulnerable, they might have some use. A mask mandate, like the ones I've heard some politicians propose, I think are not supported by the scientific data. And so, for instance, there is no randomized evidence that suggests that mask mandates would work to slow the spread of the disease. In fact, for influenza, the randomized studies that have been done suggest that they don't work to slow the spread of the disease. Now, I'm not against masks. I think that, again, as I said, they have appropriate uses in appropriate places. We should take seriously what the scientific evidence is saying and not adopt policies that are far beyond what the scientific evidence has said. There's a reason why early in the epidemic that the World Health Organization, the CDC, didn't recommend masking sort of all the time. I think there are also some enormous social harms caused by these masks. Masks have become a political issue, a partisan issue, right? You wear a mask if you're a Democrat, and you don't wear one if you're Republican, and you look on your fellow citizens and say, well, you're being irresponsible, or you don't care about freedom. I think public health should unite, not divide. And masks, I think, have become an issue, especially these mandates. When it turns into a political issue like this, we have to think, as public health, folks who do public health, we have to think very carefully whether we've actually done the right thing. And I think we've done a very, very poor job with the messaging, taking the science seriously, and we've created a disunity in the populace around masks, the distrust for one another that public health is not supposed to create.
So you mentioned trusting science, and that's something that Trump's critics have said over and over, that he does not trust the science. What's your read on that? And then last question, Mike Pence is in the hot seat tonight. He's got a vice presidential debate with Kamala Harris, the senator from California. He's certainly going to have lots of questions about his role chairing the coronavirus task force at the White House. How would you grade his performance, and what do you think is the strongest case for both sides on this issue?
I'm sorry, can you repeat the first question? Because
that
first
problem.
question is really important.
When people have said that Trump doesn't trust the science, or that his administration has not
let me address
followed
that,
the science.
I'll address both of those one by one, because those deserve like different,
Sure.
full thought. it's really been disheartening to me to see the scientific community suppress people who didn't agree with what the folks who controlled the messaging, for instance, Dr. Fauci and Dr. Birx. They have one view of the science, but it is not the only view, as you can see from the Great Barrington Declaration. There are a very large number of scientists who have a very different view and read of the evidence that's coming out. When people say follow the science, what I've seen is they often mean censor scientists who don't agree with some scientists, the people who are sort of controlling policy. I myself have faced accusations of saying dangerous things when I just am describing what I see in the scientific literature. My job as a professor is to read the scientific literature and describe it, the implications of it as best I can. And when I've said things that based on my honest read of the scientific literature, I've faced accusations of saying dangerous things for the public. I think that itself is dangerous. We should not censor science. There is a large-scale scientific debate, as you can see from the Great Barrington Declaration, around this about the science and policy of COVID, and yet only some voices get amplified in the news. I think it's a mistake. It's a mistake for science. It's a mistake for policy, and I really regret that it has happened. And I hope that can get rectified going forward. You asked about Vice President Pence and the task force. Well, as you probably know from the Great Barrington Declaration, I'm a critic of the policy of general lockdown, and I think a lot of the messaging I've heard from the task force is focused on lockdown. I think it's time to turn that around. Now, in the United States, we don't have a national policy. We couldn't because we have federalism. We have state policies, and I think some states have done vastly better than others. So I'll point to Florida, I think, as an example of a success story. South Dakota, I think, is we'll see. It's going forward exactly what happens because it's still time. There's still, the pandemic is obviously not over. But at this point, I think states like Florida and South Dakota have done considerably better than states like New York and New Jersey, which have had some of the very highest mortality rates per capita in the world from COVID, and they're still on lockdown, imposing enormous non-COVID costs on their children, on their adults, and on the vulnerable people living in New York.
All right, Dr. Jay Bhattacharya, we appreciate your time. Thank you for joining us here on Just the News.
Thank you.